I would like to highlight a few differences between femtosecond-assisted cataract surgery, phacoemulsification, and mechanical fracturing. Now, mechanical fracturing is how I do most of my cases. With femtosecond-assisted cataract surgery, you are using the femtosecond laser to create the capsular rhexis and to subdivide the cataract. And it does require energy that's being transmitted into the middle part of the eye. So unlike in LASIK, where the energy is mainly confined to the cornea, here you're using energy all the way down to the middle part of the eye. And we do know that femtosecond assisted cataract surgery can be associated with progressive pupillary miosis during the case. Why is that? Because there is liberation of prostaglandins during the surgery. And we know that increased prostaglandin release, of course, may be linked to CME later on. Same thing applies with phacoemulsification. We are using energy, we're using ultrasonic energy. Now this is confined the middle part of the eye, just like the femtosecond laser. And basically the ultrasonic energy causes increased prostaglandin release, which again can also increase the risk of CME. And there are many studies actually comparing the rates of CME between the femtosecond laser and phacoemulsification. And some reports show that the femtosecond laser has a higher risk of CME relative to phacoemulsification, and some reports have it reversed the other way around. But what I want to highlight to you in this video is that mechanical fracturing, which uses position one to bring two instruments, in this case the chopper and the phaco tip, towards each other to fracture either the heminucleus or a quadrant, or even on primary chop where you're not actually using any vacuum, you're actually not liberating any prostaglandins because mechanical energy is not pro-inflammatory. It's entirely mechanical, and it is very, very strong. On the densest of cataracts, very, very dense cataracts, the femtosecond laser may not work. But with mechanical fracturing, you could employ the forces and the right vector forces to break up pieces. So with mechanical fracturing, now if you're doing the entire case, 100% of the case, without any ultrasound or laser, then there should be no rise in prostaglandins. Even if you only, say, use phacoemulsification for a significantly reduced amount of time and spend, let's say, 95% of the case with mechanical fracturing on position one, well, you'll at least have less prostaglandin release than you would in the other two traditional techniques. And so I always say, if it's my eye, I would want to limit the amount of energy being delivered into my eye, whether it's with femtosecond laser that's going here and going all the way to the middle part of the eye, or with ultrasonic energy. And so I always think that the ideal technique is a technique on position one where there's no vacuum, there's no surge, and it's the least pro-inflammatory technique. Anyways, I wanted just to highlight these three techniques for you, and I hope you found this video to be useful.